My name is Juliana Fellows. I am the Community Prevention Manager here at Prevention Action Alliance, overseeing youth and young adult services, which includes the Ohio College Initiative Network. I'm sure I've said this, I don't know how many times before these webinars. Well, actually 13. This is our 13th webinar. And as a reminder, GEERS is, let me start out with making sure you know you're in the right webinar. Today's topic is a trifocal lens of student wellness programming sustainability with a focus on financial support, collaborative partnerships, and faculty well-being. And we happen to have three great panelists going to address those topics. But first, as a reminder, the Rise and Thrive project is developed through funding from the Governor's Emergency Education Relief Fund under the Coronavirus Aid, Relief, and Economic Security CARES Act. OCI, the Ohio College Initiative, is a network of Prevention Action Alliance and is a partner in this project with the Ohio Department of Mental Health and Addiction Services, Prevention First, the Ohio Program for Campus Safety and Mental Health, and the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. So these webinars were developed to promote campus and communities working together and provide the opportunity to engage with state and national experts on topics that promote campus and community partnerships and enhance student wellness. As Ashley mentioned, CEs are being offered. Webinar recordings can be found on the Ohio College Initiative webpage through the Prevention Action Alliance website, should you want to go back and review and watch any of the previous 12 webinars. So now I will introduce our speakers today. Our first speaker is Amy Horgan. She is the Director of Substance Abuse Prevention and Education at the University of South Carolina. Our second speaker will be Kevin McClure. Kevin is Associate Professor of Higher Education and Director of Communication at Alliance for Research on Regional Colleges. And we, last but certainly not least, we have Dr. Allison Smith. She's CEO of AMS Consulting, and she has a PhD in Educational Leadership, Research, and Counseling with specialization in Higher Education Administration. So thank you for the three of you for being here today. I also want to add that we will take questions. We will have our question and answer sessions after each of the speakers have time to make their presentations. So please, please, please put your questions in the Q&A, as Ashley said, so they don't get lost in the chat. Amy, I'll hand it over to you.
Great, thank you so much. And I want to say thank you to everyone who's done the work behind the scenes to pull this together today, because I'm excited to learn from the other two panelists, as well as to be able to share some of the work that we have done and maybe provide some insight and guidance for your efforts in Ohio. I will issue a little disclaimer, which is that my office is located in our recreation center, which means we get, and it's open concept, and so we get lots of fun music and basketball noise and folks wandering around. So I'm going to apologize ahead of time for any of that noise that you might end up hearing. Just know it's a fun part of how we work here at South Carolina. So hopefully y'all can see my screen. I am kicking us off talking about some of the collaborative partnerships and some of the ways that we can work with our stakeholders and within our organizational structures to hopefully sustain some of the work that you all have been doing over the last year or two. So we're starting really talking about our stakeholders and who they are and how we keep them around, and then those organizational structures and what they can do to help us sustain and keep going in the work that we do. I am going to use the example of our Carolina Community Coalition as we go through this, just to give you some context and examples and a resource for that kind of thing. Obviously, this can apply to work that's not coalition based, but I know that's some of what the projects that y'all have been focused on. So I thought it would be a good place to serve as that reference and example. So our Carolina Community Coalition has actually been around since 2008. Like a lot of places, began meeting in response to some alcohol and drug related deaths among students, a boom in apartment communities in the area, and just a shift in some of the drinking culture within campus. We were awarded a grant from our state agency with really an intention to build capacity, to do a needs assessment and figure out what are the environmental strategies that we could make more use of. Might sound a little familiar to some of you. The focus at that point, maybe still is, tailgating, social host rules, merchant education, how alcohol is being advertised, compliance with alcohol laws, and bystander accountability. I will say, I don't think that focus has changed very much in the last 10, 12 years. And we spent a lot of time talking about how we coordinate data. So we do a lot of work together to triangulate data and share data across and outside of our silos. So some of the successes of this group, just to give you some frame of reference and examples, you will see that we kind of run the gamut from things that are, if you think about the socio-ecological framework, within the individual interventions, group interventions, as well as policy and enforcement interventions. And so while the coalition has focused on environmental management strategies, we really have taken a look over the last 10 years at what are all the things that influence the environment in which our students make their decisions, and what are the things that are within our sphere of influence, to impact, to change. Where are the things where we need outside partners? And I am happy to answer questions or talk with folks about any of the successes and accomplishments of this group, but I do think it's important to show the breadth of work that we have done. It has not been a successful strategy for us to say we're going to pick one thing and just do it. We had to say across the socio-ecological framework, what do we need to address, and let's manage all of it. So let's talk about our stakeholders. There are a lot of folks who are natural partners, I think. And so when folks get together to say, we need to talk about this issue of alcohol or drug use of any kind, any health and wellness topic, there are some folks who pull together quite naturally. So our conduct and the students folks, our friends in health and wellness and the counseling center, often our law enforcement friends, although we can talk about how they might need to be engaged in different ways than some other folks. Fraternity and sorority life are often very concerned about some of these things. Our off-campus living friends are the ones who get the calls from the neighbors who are upset about student behavior in their neighborhood. And so they're often a low-hanging fruit to pull into a group like this. But there's also other folks that you can think about outside of the box. So our folks who do campus activities, who do campus recreation or first year experience, those folks are influencing the campus environment. They're having an impact on student behavior and substance use, and they may not be fully aware of how their work is related to the work that you are trying to do. So if there's an opportunity there, this may take some efforts to have conversation to connect with them. Another place that I think we often miss is faculty, and I'm glad we have faculty on the call today, right? But I think we can look around to folks. We've had very good relationships with psychology and social work and public health. Those are the avenues that kind of make sense, and where there's faculty who have interests that align with the coalition. We actually have great partnerships at Carolina with our criminal justice and sociology faculty. Those are the ones who've actually been able to pull students and graduate students in to do research projects on what's happening in the campus environment. How is law enforcement and policy impacting student behavior and crime and that kind of thing in our off-campus districts. And then off-campus, we're constantly looking not just at law enforcement, but our neighborhood associations, our folks who own property, our managed apartments, business owners, bar owners, folks who, merchant associations, local agencies, and nonprofits. So hopefully there may be other folks that left out, but that's who we are constantly saying, who are all the folks that need to be involved? This truly is our capacity building part of the prevention framework, right? This truly is about building our capacity, making sure that we are capable of impacting what we're trying to impact. And it's also about that multicultural competence. So looking around and saying, who's at this table that cares about this issue? Who isn't at our table? Who's missing? What perspectives are we not hearing? How do we get the right person to the right meeting at the right time to bring some cohesion and to move things forward on an issue? And one of the groups that often I think are left out of this work is our students. And so it does not matter if they're peer educators, if they're graduate students, if they're student government, they have something to say, they have something to contribute. And so bringing them in to say, tell me about your experiences, tell me about what you think matters when it comes to prevention work can be really helpful, not just in learning more about their experience on campus, but also about changing attitudes and beliefs of our senior leaders. And so a lot of times it's the voices of students that can be more impactful than our own when used strategically. And that can go for good or bad, right? So depending on what you're trying to accomplish. And then who's at the table that their voice isn't heard? Students are going to be fairly intimidated being a room full of administrators. And so may not want to raise their hand and say, you guys are way off base. That's not where people are partying, or that bar hasn't been in operation for a long time, or that's not the cool place anymore. You got to make room for them to be vocal and share their concern. One example of how this has worked for us is that the University of South Carolina is the large flagship within the state capital. We are 35,000 students. We are the college that people think of when they talk about college students in Columbia. And then last summer we said, you know, there's actually 3 other schools, really closer to 5 when you add in the 2-year schools, that are not being thought of, are not included in this conversation about what our experiences are of college students in our entertainment districts and in our bars. And so how do we make their perspectives, how do we bring their perspectives into the conversation? And so 2 of those campuses are historically Black campuses. One of them is formerly all female, and all 3 are very small campuses. And so put out the invitation and said, we want to hear your perspectives, and the opportunity for them to share their experiences in our entertainment district, the differences in their resources and how they socialize and how they use alcohol was really insightful, not just for our students and our leadership to be able to work closely with them, but they had great conversations in this series of events with local law enforcement and with our bar owners and district entertainment folks. And that was a really fruitful conversation and perspective that had not been heard. And so we made a point of saying, let's elevate this voice because we think it's one that is being neglected. When you're engaging folks, I think one of the things, especially when you're reaching to those out of the box folks, is how can you help them understand how their activities connect to your goals? Like, where is the overlap between what they are trying to do and what you're trying to do? And our campus activities folks are a great example of this. They tend to be young professionals, very excited to do all the fun, great events that campus activities folks get to do. They often have not given any thought into how that connects into the larger campus environment, or how the work that they're doing is actually reducing substance use on a Thursday night if they're doing a very popular Thursday night late night option for students. And so, you know, we pulled in our campus activities folks and said, I want you to be a part of this, I want you to listen. And I had coffee with that person several times to say, here's how this kind of connects. She is now our biggest advocate. She totally understands how the work that she's doing helps impact student substance use, and is able to get the student programming board and homecoming and all these other organizations to connect and do things on Friday nights, and to be interested in making that impact, not just because it's fun, but also because it's making a difference for students. That's one example of how you can kind of pull them in and talk about mutual goals. And then finally, I want to talk for a second about communication before we move on. You know, I think there are a lot of different ways to communicate, and I think it's really easy to get overwhelmed trying to do too many. And so one of the things that we have been very successful with is an email newsletter that goes out once a month, a week to 10 days before our monthly meeting. It says, here's the topic we're going to talk about. Here's some resources. Here's some research. Here's some data that we have. Here is some local news articles that are relevant to this topic. And that really helps pull people in to the conversation and want to get involved and more interested. They feel like they've learned something before they come to that monthly meeting. It also means our faculty can connect to a specific topic and say, oh, this is a policy issue that I've been talking about in my social work class, and so I'm going to encourage students to participate in this meeting. It gives us a chance to say, hey, this is what we're doing. It's one of the biggest criticisms we heard from our neighbors and our involved stakeholders in the community is that they didn't feel like the university was doing enough. It really turned out that they didn't know what we were doing. And so being able to put it in a format that is easy for them to connect with, even if they don't necessarily come to the meeting or read it right away, that information is there and able to spread. We don't spend a whole lot of time on social media for coalition work. For what we're doing in terms of student education and social norms, my peer educators run lots of social media directed at students. But for the work that we're doing for those larger stakeholders, for adults, we're not necessarily using social media as a, that doesn't mean it wouldn't be successful for somebody else. We're just putting our energy into a different people. And then finally, one of the mistakes I think we often make is not explaining to people how this is all connected and what the work is that we're doing. And so being able to say, now don't, without beating people over the head too much, this is where we are in the strategic pivot framework. This is a thing we're talking about because it's relevant to some of this theory or work that we know is important or best practices. It really helps people for you to be that backbone expert, to say this is how this all connects with why we're taking this approach. Especially as we talk about the biennial review, which I'm sure everybody is working diligently on this center. This is an opportunity to connect back to why do we do things this way, or why are we picking this strategy and not others. All right, so now I'm going to talk for just a second about organizational structure. Conscientious of my time here for my friends who will also share. So in 2015, it was 2016 when I arrived on campus, this was our organizational structure. The coalition had a steering committee full of folks who made decisions, and then was it 6 or 7 subcommittees. These subcommittees had designated representatives from specific offices. They had designated leadership. The person in my role had been attending all of these meetings every month. Each group had a purpose, had a goal, had goals, had outcomes, had measures. And as I started talking to people when I got here, they said, I'm so tired of these meetings. I am so tired of talking about the same things over and over again. We have all these numbers. We don't know what to do to make any kind of impact or change on any of these topics, and we're just tired. And so we said, well, how much do we need these formal structures? How could we adjust our organization in order to make it a more adaptable group, a more successful group, and one that people actually want to show up to the meetings? And so we shifted into a project group model, which really allowed us to identify specific short-term projects throughout the year, and then meet until they're completed, and pick people who have availability and interest in that topic, in that time frame, and participate in being a part of something that actually, a group that actually accomplishes something. And so this is what it looks like now. We have 3 work groups for this year. Our alcohol license protest, which is a group that has been around for a long time, but that work is truly more long-term. We have a rapid student feedback group that identifies an issue each semester that they want to hear from the student perspective, something where we need more than just what our campus data has to show. And then this summer, we've got a biennial review group that will meet and write our biennial review and pull that together. That's our task force. That's our folks and what they're working on. Over the last since 2016, these are some of the other examples of work groups where we have picked a specific issue and topic, pulled in folks who were interested in that topic, and were able to make progress. And that has really reinvigorated some folks' interest. It also has allowed us to really utilize people's skills and talents. And so those project leaders can be folks on the steering committee. They also can be a coordinator in student conduct who really is interested in how we promote the Good Samaritan policy and wants to create that for us. And we pull in other staff and folks who have an interest, or a law enforcement professional who wants to be a part of something that he doesn't get to do in his regular day job. So we've given people opportunities to contribute in different ways, to use their skills and talents. We still give people opportunities to just show up. So if it's a busy season, you got a lot to do, you just show up to our monthly meeting and participate and contribute, and that feels like you've done something. You've been a part of something, you care about this issue, even if you don't have capacity to contribute at the moment. And then the other thing we've done is leverage the biennial review, the college aim. That's really what we went to when we said, okay, we have all these goals and outcomes and measures, but how are we going to accomplish something? Let's look at the college aim. Let's pull that up. Let's put it in a spreadsheet and say, what are we doing? Which of these things would we like to do? And how would we go about it? And so that has been a helpful process for us. Other thing I think is important to think about in terms of resources. And so what are the things that you need to accomplish the goals that you've identified in that, in your strategic prevention plan? We have talked a lot about political and social support. We filed legal protests against 10 bars that were not operating in healthy and safe ways. We needed political support. We needed support from our senior leadership as well as from the community in order to be able to be given the time and resources to work on those. So that's, just one example of all the different pieces that have to come together to say, what is it we really need to accomplish this? It's not necessarily just the data or just that particular intervention or that software program. We have to look across and say, what are all the things we need and where are our skills and talents to be able to accomplish that? So I think I'm done on time, hopefully. Happy to take questions if you can put them in the Q&A. I will stop sharing. And I think I'm turning it over to Dr. McClure.
Thank you so much, and good afternoon, everyone. It's a pleasure to spend time with you all today. And I'm here to share a slightly different lens on this question around student mental health and wellness, which is to think a little bit about colleges and universities as organizations, and importantly, the people who work there. So for the last couple of years, I have been writing and speaking on issues of faculty and staff morale, burnout, disengagement, and understaffing connected to the work that I do in college leadership management and finance. And so as part of that work, I have been sharing a very simple message, which is that we are in the midst of a transformative moment in higher education in many ways. One of those ways is, of course, that we've got students that are arriving to higher education with significant needs. Numerically speaking, we've got more students that are seeking our help. And of course, in some cases, the severity of the issues that they're bringing to campus have been dialed up. At the same time, we have faculty, staff who, many of whom have really felt the past couple of years And in many ways, the pandemic has dialed up or intensified a series of problems that existed in higher education even prior to the pandemic. So at the same time that students are arriving to our campuses, needing some additional attention, needing additional care, needing more services in order to find their place and be successful, we've also got, in many cases, faculty and staff who are running on empty. And so the key piece that I want to share with you all today is my very strong belief that student success, student well-being is very much a function of working conditions and working cultures at colleges and universities, which is to say, we can't expect to adequately serve our students if we don't put proper investment into our people that make our institutions possible in the first place. And so what I want to start by sharing is a little bit of what I have learned about the higher education workplace, and in particular, some of the experiences of faculty and staff over the last couple of years. So I've been doing interviews with faculty and staff at all different types of institutions across American higher education. Close to 50 interviews with folks in the process of doing some writing and research that I have done. And through that research, what I've learned is that we're really seeing three big shifts occurring within our higher education organizations. We've got people that are doing some reevaluation, by which I mean they are starting to think a little bit differently about the place of work in their lives. They're starting to think a little bit differently about how much time they are willing to dedicate. And in some cases, reevaluating the extent to which, out of a pure sense of altruism, they are willing to go above and beyond and put in extra hours for our institutions. Some of them are seeking reassignment, which is the term that I use for folks that are looking to shift jobs within the same organization. So they are looking for a change, they are looking for a different scenery, they're looking to work with a different group of people or a different supervisor. So they may not be entirely leaving their organization or leaving the profession, but they are looking for some type of new opportunity within the organization. And the reason why this matters is that it still creates a vacancy within our colleges and universities, even if somebody moves from one office to another. And then lastly, of course, you've got folks that are resigning. So higher education is 100% implicated in this movement connected to the Great Resignation. And we have significant turnover happening. We have folks that are seeing ways in which their skills in higher education are in demand in the private sector, perhaps in a way that they were not even a couple of years ago or prior to the pandemic. So no matter what, all of those phenomenon can have ripple effects across colleges and universities. And the reason that this matters for our conversation here today is because it has real ramifications, I think, for the capacity of our institutions to be able to meet the needs of students. So some of the ripple effects that I'm talking about include things like we've got institutions that are constantly running searches or have people in interim roles. Because of turnover, we may have offices that are not adequately staffed. In some cases, they may have been thinly staffed or stretched rather thin leading up to the pandemic. But as a consequence of some of the shifts that I'm talking about, they have even more gaps in terms of their personnel. We may have problems connected to folks not wanting to step into leadership roles. They saw what was asked of their supervisors, and maybe at a point in the past, they would have had some interest in stepping into those roles, but now they aren't as interested in that. And so we've either got folks that are forced into management positions that are doing so reluctantly, or we have people that are, or we've got gaps even in some of those leadership or management positions. And then across the organization, we can start to see kind of further ripple effects in terms of not being able to meet some of the goals that we have set for ourselves, whether it's in the form of recruitment or retention or completion, or being able to serve students that really need our support. I think that the other way that this plays out is, of course, more at the individual level, more at the level of those of us that are working as faculty and staff in higher education, and perhaps are not hired with the idea that our top responsibility is going to be serving students' mental health needs, but nevertheless, by virtue of our roles and our positions, we are part of the ecosystem of trying to serve students and promote their success. And so we've got faculty and staff who are being called upon in new ways to try to step up and serve students who, again, are showing up and coming with significant needs, when we ourselves are not always fully supported by the institutions that are employing us. And so as we are thinking about the sustainability of programs to support student wellness and mental health, and as we are thinking really about the next 5 to 10 years in higher education, I think it's going to be really important for us to be much more intentional about designing and implementing working conditions and working cultures that support faculty and staff, that create the conditions and cultures in which faculty and staff can thrive. Otherwise, my real concern and my real fear is that as organizations, we're not going to be able to meet the goals that we have set for ourselves, and we're going to see students who they themselves really feel the lack of capacity or the lack of infrastructure in place in order to support them. So as a faculty member myself, I'm the coordinator of a master's degree program. That means that I serve as the primary advisor for 50 students. I am their primary tether to the institution. I am their first point of contact before they try to access any other type of services on campus as graduate students. I'm kind of the first line of defense. And so first of all, we could probably ask questions about how wise it is for that to be the case. We could ask another set of questions around whether 50 students to one person is the right ratio. We could ask questions about whether a faculty member is the right person to be in place, to be in that position of being the first contact for students and students in distress. And we can ask questions about to what extent there's any training made available to me as a faculty member to support their well-being and success. The answer to that is so far there has been none. And so just through that small illustration, we can get a sense, I think, of some of the real problems from an infrastructure and personnel vantage point that can really threaten, I think, the sustainability of efforts to try to serve students well. So as we move forward, I just want to share a couple of ideas that I think can help to create better working conditions, better working cultures to support faculty and staff that will allow us to recruit and retain more people in higher education, and through that, hopefully be more successful when it comes to serving students and sustaining the types of efforts that have been developed in order to help them be successful. So one, of course, we've got to be putting more investment and more dedicated attention into training our faculty and staff who are not directly hired into student service type roles, but are themselves nevertheless in positions where they have a great deal of student contact and are being called upon in new ways to serve students that have perhaps mental health issues or just need some additional support. So training for faculty and staff, I think, is going to be critically important, and helping faculty and staff figure out what their proper role should be, and to understand ways in which they are not there necessarily to serve as counselors, but rather to be as folks that can relay students on to people who are better trained and in a better position to support. Second, we have to, I think, take a good hard look at the working conditions within our institutions. That includes things like workload, doing an analysis of workload, looking at staffing levels and the extent to which we have adequate staffing levels. And through that, being able to target and figure out where there are stressors or ways in which our systems are really being taxed. And it is not going to be enough for us to simply continue operating and enrolling new classes of students, I think, without taking a step back and looking at some of those systems and making sure that we have the infrastructure in place to adequately serve them. I've been sharing with all leaders that that it is going to be critically important to all of us as humans, all of us as faculty and staff, that we do a good job of trying to learn from what the past couple of years have been and really bearing witness to this moment that we have experienced. And so what that means is pushing back against that strong tug to just move ahead with the next thing, whether that's recruiting the next class, doing the next orientation program, building the next schedule. We in higher education tend to have fairly short memories, and it's very easy for today's crisis to get eclipsed by whatever the next crisis might be. It would be a real shame for us to not learn anything from what we have been able to both, what we've experienced, but also what we've achieved in the last 2 years. And so that means doing a better job of keeping track of data and collecting data around the experiences of faculty and staff, to get a sense of where there might be problems, but also where there might be opportunities to implement greater flexibility, for example, in a way that helps to, again, kind of keep people in place. So these are just a couple of ideas, a couple of possibilities around restructuring working conditions and cultures in higher education with an idea, with an eye towards supporting the people that really help to sustain our institutions, and in turn, the people that are responsible, I think, for maintaining the sustainability of student wellness programs. So I'm going to end there and pass things over to my colleague, Allison, to make sure that she's got adequate time to wrap us up.
Thank you, Kevin and Amy. Thank you to Prevention Alliance for having us here today. I'm going to go ahead and share my screen to jump into some slides that will get us started. So let me give my disclaimer. Amy gave me a disclaimer. I love disclaimers. There's a lot of slides, but don't be alarmed. So a little bit more about me. I'm a native of Baton Rouge, the youngest of 7 kids, could live off a diet of hot wings and crawfish every day if it wouldn't kill me or give me high blood pressure. I got my master's from my undergrad from Southern in psychology in 2009, my master's in public administration from LSU, and then I got my PhD from LSU in higher education administration. I'm still upset about how Game of Thrones ended, and I wish we had more than 5 seasons of Insecure. So that's like my real about me bio, right? So some other background is that I started this career in prevention at Louisiana State University, where I worked on campus for 8 years. When I went there to get my master's, I found a graduate assistantship job on campus. At the time, the associate director who hired me while I was away doing an internship. By the time I came back, she went on maternity leave and never came back. And so it was me and a part-time consultant running that office, and I've been the only consistent staff person in my office since 2010. And so our office was on campus from 1997 to 1998, from 1998 to 2018. That office got started as the result of the nationally publicized death of Benjamin Wynn, who was a student who died due to hazing and binge-related drinking. LSU was selected to be part of the Robert Wood Johnson Foundation's A Matter of Degree program, where they gave money to 10 campuses to employ environmental strategies to reduce high rates of binge drinking. One of the really cool things that came about at that time was LSU late night. Typically, when we see programming on campuses to target high-risk drinking, it's in the daytime and things of that sort, in the free speech alley or by the unions. But LSU late night occurred on like Thursday, Friday, Saturday nights from 10 at night to like 2 in the morning. It was direct counter programming to high-risk drinking times. 20 years later, LSU found itself in a similar situation with the nationally publicized death of Maxwell Gruber under very similar circumstances to the death of Benjamin Wynn. At that time, the governor and our state leadership realized we have nothing at our state board of higher education that focuses on prevention, hazing in our colleges. So in July 2018, our office moved to Louisiana Board of Regents, which oversees all public higher education in the state of Louisiana, which includes 4 public systems: our LSU system, our regional system, the University of Louisiana system, our technical and community college system, and then our Southern University system, which is the only HBCU system in the country. We have a double-pronged approach. We work for I work at the Board of Regents, but we are completely, solely, totally funded by the Louisiana Department of Health the Office of Behavioral Health to be specific. It is in this double-pronged approach that we help to meet the needs of both the campus communities and the Department of Health. And I'll share a little bit how we do that at zero cost to our institutions. So again, the double-pronged approach for our office, we have a statewide focus. That is where, so the official name of our office is the Louisiana Center Addressing Substance Use in Collegiate Communities. You don't have to remember that. But in that capacity, we sit on several task force or committees out of our, on the Governor's Drug Policy Board. So the State Epidemiology Work Group, the Prevention Systems Committee, and the Heroin Opioid Prevention Education Committee. And what our role there is to bring the influence, the impact, and the data from higher education. We provide that service to the state. And so we get to sit in on the policy discussions that are made for our state. And so when we work with our campuses, we kind of work under our coalition. So our office also oversees our statewide prevention coalition for higher education. That is the Louisiana Higher Education Coalition, our LAHEC coalition, which functions very similar to the coalition in Ohio. We do that through research and evaluation. We do the core alcohol and drug survey every 2 years for free for any campus that wants to participate. We provide technical assistance to campuses around specific alcohol, drug, mental health, sexual prevention type related issues. And we do professional development, which we have our annual summit coming up. Will be virtual this year. We do free webinars, training, very similar to what you all have. So I'll talk a little bit about some of our campus community collaborations and partnerships over the years and how they've kind of helped build momentum and set the stage for where we are now. Our very first one that I can tangibly remember was Who Will, I Will. And it's really great. We talked, some of my co-presenters talked about the working with faculty. This was with working with the faculty. Sometimes we tend to go to the same faculty, like Amy mentioned, psychology, different sociology, social work. Well, this was from working with one at LSU. We were at LSU at the time. They have an amazing mass comm program. This is from a public relations campaign. The students that were graduating, this was their capstone project. They created, they decided to do a blood drive for their capstone project. They gave away tickets to Bayou Country Superfest that first year. They got all of these things donated for free. And they decided that because people in their age group drained the blood population due to alcohol related crashes in our state, they wanted to contribute to being able to refill in that. We worked again with another campus, with another group the next year graduating. They gave away for their big grand prize was a trip to Cancun for spring break. They got a trip donated to them. This cost us zero money, and it cost me probably about 6 hours each year meeting with the students, a 2-hour like intake meeting. We talked about all the details. What do we do? They did a complete SWOT analysis, campaign booklets, and they had these very tangible things to take with them upon graduation so they can say, this is the work that I've done for an entity in the state of Louisiana. So once we started to do those programs, we had other campuses around our state because we presented at our annual conference about it. And it's like, hey, we want to do something similar here. So we connected their local behavioral health office with the campuses there. And this was the campaign that they came up with and financed in their particular region. So as time goes on, this is a campaign that was done by our Baton Rouge Regional Behavioral Health Office. These were young ladies from different community organizations, high schools, and they were presenting their short films and their stories, their artwork about making healthy choices, not drinking and driving, all of those types of things coming up to prom. And so I attended this event back in 2018. That's me in my dress, but there's really a purpose to that. This lady here, our office, she was executive director at the time at Capital Area Human Services. When I came into my role and I became a full-time staff member, people were like, you should probably try to work with Capital Area. Your office has never really worked with them. There's just not been a great relationship. And I was like, well, why not? And nobody could give me an answer why. So as I began to work and continually build relationships with our community partners, not only did I attend that event, I actually hosted it. After working with Vivian over some time, she asked me to host that particular event and facilitate a conversation with the students that night. And part of that was just to me showing up, starting small, saying, hey, these are the things we've been doing. This is the work we've been doing. I'd like to partner with you. Please let me know when you have something. The next step. So this is our third campaign of this sort, working with the PR class of students that's graduating. But what was different about this campaign and the previous two is that the first two, I had zero money. This campaign, I had a $25,000 budget. But this is the catch. It wasn't from my office. It was partnering this group of students with Capital Area Human Services, the group I just talked about, the local health office. I said, hey, we're in the process of a move. I can't really take on that project right now, but I have a great community organization who would love to work to focus on underage drinking in the city of Baton Rouge. And those students got a $25,000 budget. They learned that they cannot serve bourbon chicken at a underage drinking event. They got all this real world experience. They were going to change the napkin design and decided not to because it was too much paperwork to change it. So they had all this real world experience. And what we find is that when we engage students and our community partners in meaningful ways, we haven't run into a no yet. And so after that continued partnership with Capital Area Human Services, we also had one of their staff members come in and train one of our campus law enforcement departments. We set up a training with the campus, provided lunch, and Capital Area Human Services came in and did Narcan training and gave free Narcan to make sure that all of our officers had Narcan training and Narcan for their persons. So again, building those relationships one step at a time, one interaction at a time. So I will say, I would love to tell you that I've only had successes, but that's not the case. And so we tried to get a collegiate recovery program at LSU, and that was in 2015. They still do not have a program, but we are working on some things there. And so sometimes our good ideas aren't in the right time. And so literally 4 years go by before I get a call from one of our systems saying that, hey, one of our board members went to this conference and they would talk about collegiate recovery and they want to know, why don't we have any programs like that in Louisiana? And I was like, well, actually, you have a campus in your system that is trying to start a program. They just haven't been able to get any traction. And so I have a liaison at all of our institutions. After this presentation to some of their board members, some of their senior administrators, she called me and she said, I don't know what you told them, but they're like fully on board with the collegiate recovery thing now. And so this was our Commissioner of Higher Education, Dr. Kim Hunter-Reed, at the ribbon cutting to unveil their new collegiate recovery program. It was the first one in the state of Louisiana, supported with funding from the Louisiana Department of Health and support from our office as well. And so we now have two, the one at program at Southeastern, the program at Tulane University, and we will be gearing up to launch more across the state over the next few years. So we have the social norms campaigns going. We have the collegiate recovery program. The next month I was privileged to go to DC. We had a conversation about campus naloxone access, because that was something we had begun to talk about in our state, because we knew, that's me at the table down there. We knew that it was a growing issue. So now, yesterday being National Fentanyl Awareness Day, the first one, that we are starting to see that we know that college students tend to use opioids less, but we are starting to see fentanyl show up in additional drugs that college students more likely to use, such as amphetamines, methamphetamines, cocaine, Adderall, Xanax, things that, and so the thing that reverses that is Narcan. And so being strategic about how we address that particular issue. And so that was some of our programming things. As far as our policy, here's the funding catch. We know pretty much everyone who works in prevention, health, any of those types of things, our money federally is in opioids. But I always tell our campuses not to go chase the shiny carrot. We know that. And so my discussion with the Department of Health was, yes, I can talk about opioids, but that's not necessarily the exact problem we have. Whenever I talk about opioids, is there anything wrong with me talking about alcohol, marijuana, cannabis, any of those other drugs, coke? And it's like, well, no, there's nothing that says you can't talk about it. You just have to also talk about opioids. So we decided, sitting down, reading in between the lines, what can we do to serve our population and meet everybody's goal? And so for us, we knew in our state that we had legislators in our state and state Senate, House of Representatives that wanted to do something around opioids. We know that there are a ton of divisive issues when it comes to state government, our political arena, but one thing that does tend to stick across lines is opioids. And so we honed in on that, and we had support from all four of our public systems, as well as our Louisiana Association of Independent Colleges and Universities, to do something surrounding opioids, which we got together with our systems and we addressed what issues would we have, and we wanted to give everyone naloxone. They wanted to know who would pay for it. It's like, hey, one thing I can do, I don't mind asking for money. We got the Department of Health to pay for it. How do we get access to training? We created training modules, and we will come in, or our community partners will come in and do Narcan administration training. What about a participation refusal? Somebody doesn't want to do it. So our agreement was they don't have to do it, but they do have to train, because we would hate for someone to be in an emergency situation and say, if I would have known what to do, I would have given them Narcan. You have to be trained. If you don't do it, you still have to call emergency medical services. And then the last piece was reporting requirements. We wanted to make the reporting piece as seamless as possible. So there's a very short reporting form, 1 page if there's an administration, and 1 page a quarter to kind of certify if they need any new kits or had any administrations. Very simple reporting requirements, which led to our border regions education training and reporting policy. We utilize Generation RX through the Ohio State University's Higher Education Center. We utilize Generation RX for our training. We do training in person and virtually. And then we have reporting requirements that I mentioned a few moments ago. And so realizing that we're all in this together, that helps us serve everybody's purpose. That's the key, being able to find ways that your activities will serve other people's missions so that they can pay for them. And so when our campuses do get their Narcan, they get it from their regional behavioral health office. They don't come to me. I'm in Baton Rouge, where the red circle is for capital area CAHSD. I'm in Baton Rouge. I can come and train and talk with y'all, but I don't live, work, or play in those communities. So we make sure that we reinforce strong campus community partnerships so that they can know who are the right people in their communities they need to get to, and the communities know who are the right people in the campuses they need to talk to. I would love to tell you that it goes straight from point A to point B, but it looks a little bit more like the bottom picture. So don't get discouraged on the first bump or the first no you hear. And to keep going, they're listening. And so this was the year after we had done our first set of regional trainings. This was from the Northwestern State University, their Student Government Association. They recognize opioid training. They focus on the dangers of opioid, and that highlighted piece down there is the 4 key parts of Generation RX, the four-part mission of Generation RX training. And they trained all their student government leaders, and they trained all of their Greek members, and they gave out tons of free Narcan to Greek students. So we know that they're listening, keep pushing. And for a short wrap up, when we did that collegiate recovery program, part of that was so that we made sure that we were serving the mission of those at the table. Everything isn't for everybody, and I would love to tell you that everybody is ready to do the same work, but part of that, the strategic prevention framework, assessing readiness and the capacity that people have. For us, for our office, we were ready to expand collegiate recovery. The Department of Health, through some of their different funding, state opioid response grant, state targeted response to the opioid crisis, they had funding for recovery. Who said it couldn't be collegiate recovery? And then we knew that our system, with the interested board member and the campus that wanted to have a collegiate recovery program, that was our starting place. And so with that, that is the place where everybody was intentional, because it doesn't happen on its own. It's not going to be on accident. And so for that particular school, part of their mission is on excellence in caring. And for them, that is serving people the way they need to be served while they're there. And so we talked about how collegiate recovery fits right there in the center of that, serving those students excellently while they're there. And so this quote is one of my favorites. I have not regretted a day since I enrolled. This is the student I'm in the green. The student to my left, to my right, that was her quote. She is a non-traditional age student that graduated. So excited. And she is a non-traditional age student. She graduated. She's coming to Baton Rouge to help the addicted and homeless population here in Baton Rouge. And the other young lady is coming to our campus that we're working to get a collegiate recovery program at this fall while she goes to get her master's in social work. And so we know that when we support our students, we all get together, we put our programs and our activities, our dollars, they align, that we're able to do the work of all of our agencies. And so if you've ever been on a college campus, I'll show you this. This is their new collegiate recovery space they unveiled last semester. This is a 2-part adjoining room in the student union in the center of campus. And if you've ever been on a campus, you understand that this is extremely prime real estate. And in the file cabinets, there's all kinds of snacks, coffee, that kinds of thing. And so I'll leave you with 4 small considerations. Start small. I would love to tell you that we started in the December 2021 picture with the Collegiate Recovery Program with prime real estate and the student union, but we didn't. We started with the first working with the PR class in 2014. Be intentional that it's not going to happen on accident. You have to have targeted, directed action for your goal. use their words, I was able to pull everybody's mission and say, this is where the activity that I want to do fits into your mission. This is how it helps serve this particular goal. And then present solutions. I'm like, you have money to do XYZ state or community agency, and you don't know how to do it, get it done. But I know a way that we can get this done, and being able to present solutions. And so with that, I will wrap it up and turn it back over to our moderators for questions.
Thank you, Allison, and as well as Kevin and Amy. So now's the time to ask questions, provide comments or feedback, or even if you have something, an experience you'd like to share that speaks to one of our panelists. Allison, I will say that something you said about taking time, that it takes time to develop these programs. And I think a lot of some of our participants on this webinar are experiencing that right now. I think the challenge for prevention specialists or even higher ed professionals working directly with student wellness programming is, you know, they start something, their administration might see it and think, oh, this is really great. When are the results coming? You know, like, this is really great, but you know, when are the results coming? When are we going to see results? And I struggle with that myself as a prevention person, because it's a process. The SPIF in and of itself is a process, and it's fluid. Sometimes you have to go back before you can go forward. So I guess, what is some bit of, you know, encouragement or advice you can additionally add in that respect?
Yeah, I will say this. I mentioned the SPIF because I knew there were a lot of preventionists on here. This is the thing. I have told our Department of Health that the SPIF is terrible for colleges. And so I've been very honest about that. And so we literally, I believe it was 2014 or 2016, maybe 2014, our office reworked the SPIF in the way that fit for our campuses. We took the pieces and we said, what are goals that you can do now? And we went through different pieces and we rearranged the tools. The concept was the same, but the pieces were different. Because on campuses, they do work in terms of semester. You have, and then that is a real thing that, and sometimes we just found out, particularly with our community partners, they were reaching out to the wrong person. That titles can be confusing on the campus because and they don't mean what you think they mean all the time. And so part of that is being sure that, so for one thing, Amy works with their coalition in South Carolina. So one of the things we talk about, we're pretty sure, and I talked with Logan at the Higher Education Center, I'm the only coalition that's headquartered at a board of regents. That's all for a governing board for higher education. That has been such a tremendous game changer for our office. But before we moved there, we never engaged with the board of regents ever, my entire 8 years while I was working in the office. And so if you don't know who your commissioner of higher education is, or you don't know your board members, reach out to your statewide coalition. They probably have way more context in the proper context than you do, to reach out to your board of regents and then your Department of Health. Because what's happened for us is, once I have very senior administrators at the Department of Health and the Board of Regents and our higher education committee who are committed to advancing health and wholeness for our students. And so it's very different if Allison says something, or if the commissioner emails you and say, hey, you should probably show up here, or if the undersecretary for the Department of Health emails you. It's very different. And so realizing that when you have to get different people involved, and again, leveraging all your contacts, definitely. And I think the key for me in that regard has been finding where my activity fits into their mission. And I'll tell one other piece I add, when we moved to the Board of Regents, the commissioner had just started as well, our new commissioner, and we completely redid the strategic plan. And so part of that, our goal is to increase the number of high value credentials of people between the ages 25 and 64 by the year of 2030. Where do we fit in through that? Well, we know there are a number of people who stop going to school due to their substance use. And so we get those people back into programs, that is how we do that. For the state of Louisiana that wants to decrease opioid use and get people into skilled jobs, how do we do that? We create programs for them. So we were able to show we can help you meet your goals if you give us money to fund our initiatives.
That's so great, Allison. I think I would add, like, on the opposite side, right, from the ground up, is like we collect a lot of data and we gather a lot of information, and that we very intentionally, you know, we do a May meeting with the steering committee where I'm like, here's the part where I'm going to spend the next 10 minutes showing you bars and graphs of how our student behavior has changed. You know, this is our update annually of where we are on things. And that helps keep all of the players informed so that our director of fraternity life knows what the NCHA is telling us about mental health, or that he knows he can pick up the phone and call me and say, Amy, you did that presentation. Can you send me those statistics or something that I'm working on? But it also means, like, we're constantly keeping that stuff at the ready so that when we have a new president, when we have a student death, when we have a situation, when our students behave badly at the football game and the president wants to do something about it, that I got it ready to respond. Here's pictures of the bars and how they're marketing themselves in social media, read at the ready, so that when somebody says, what are you doing about the things that are happening in our entertainment district, I can say, let me show you what I'm doing. Let me show you what the data I have. And here's the evidence that what we need to do. And so that you're at the ready to make the case when the moment comes. When somebody says, what could you do with $1 million? Give me a minute. Let me pull it up my Word file with my proposal of what to do with $1 million, because we're ready to answer those questions. And I think that's a real key for prevention folks.
I'll add that to Amy. So I keep a running wish list. If you give me money, this is what I have to do. Because typically what will happen, so, and I think all state Department of Health have kind of experienced this with influx of COVID money, that there has been money like, okay, we need to give you some extra money to do X, Y, Z, because we just got an influx of money or things of that sort. Other grantees who, sub-grantees who could not fulfill their grant obligations, like we have additional money to move around, we can increase your I have an entire wish list that I keep running. Listen, I will never run out of projects if you give me money. And so because I've made that clear and I've given them a list, like, whenever you have additional money, please come to me. I promise you I have something that you can fund. And so I've gotten substantial and consistent increases over the years because I'm always able to show this is what our data said, and this is how we can help work on that with the money if you give us additional money.
I love that, Allison. I too have a running wish list. I call it, yeah. That is really helpful information. And I'm a prevention person, so I don't work on a college campus, but our network is about supporting the work on college campuses. That being said, kind of going back to what Kevin was talking about, his focus of that faculty burnout, lack of faculty, that sort of thing. So I'm wondering from Kevin, as you listen to Allison and Amy talk about, how campuses can collaborate with their communities or go beyond and reach out to those, stakeholders who maybe they've not heard of or aren't super familiar with. That being said, how does that work for faculty who are already kind of, I love Amy's idea of always having data ready to go, always, being on top of that. But I also sometimes think that might be a struggle for someone, a faculty person who's directly delivering services, where does that, whose responsibility is it then that it becomes to keep the keeper of the data kind of thing? So, yeah.
Yeah, well, there were just a couple of things that came to mind for me connected to that. So yeah, first of all, as I was listening to my colleagues present, I mean, obviously we're talking about, phenomenal investment in time and relationship building and just sheer human hours that is necessary to, build up programs like this. And the reason why that caught my attention, and certainly there are other parts of higher education where that's the case, but those are precisely the type of efforts I think that can be most at risk right now in a moment when we've got underinvestment in higher education. We've got a significant share of the population that asks questions about the value of higher education, which has directly translated into policies for personnel and for funding that don't do a particularly good job of generously funding institutions. The reality is that the vast majority of Americans attend colleges and universities that do not have significant resources at their disposal to be able to ramp up programs that are successful. Even programs that have demonstrated success, there are not resources available to support them. And so many of them have had to come to rely financially, I think, on outside agencies, whether that's governmental, non-governmental, philanthropic. But again, I think you need people to be able to help to cultivate those types of relationships, to manage that external support. And I can't speak for my colleagues at other institutions, but I got to be honest with you, those are some of the offices where we've seen some of the greatest turnover. We just have not been able to keep people precisely in some of the roles that are necessary to do like the actual business of building and sustaining relationships. And so my perspective, to the extent that it's helpful at all, is that for some of these efforts to be successful in the long term, they need a level of infrastructure, support, and investment that I think is extremely difficult at the moment. But nevertheless, we are, I think, in a moment during which student mental health, according to surveys of college leaders, is one of their very top concerns, typically in the top 3. And if there were a moment where we could try to leverage that and take advantage of it in a way that could translate into real resources on campuses, this could be that moment. But I will, of course, defer to my colleagues who are kind of on the ground and doing some of this work to see if anything that I'm saying sticks. But when I hear what is necessary to pull off programs like this in the moment that we're in right now, it does give me some real concerns.
I can speak to that because one, unfortunately, some of your students may have seen it. There was a young lady at one of our institutions that died by suicide last week. She was a cheerleader at one of our institutions here. And so the question, of course, because I am certain that your higher education in your state is like every state, that it's more reactionary, right? And so the question becomes, what are we doing on mental health? What are we doing for this? And so part of it, I was recently promoted in December. My title changed to Assistant Commissioner for Student Health and Wellness, because our office in our state is realizing, due to the reported number of campus presidents and system presidents concerned about mental health, is that we have to take a more targeted, intentional approach towards student mental health. And so one of the things for like our strategic planning for the end of the year, my goals was that we were looking at rolling out something like mental health first aid to help other people learn about the warning signs of students that may be in distress, so that you don't need any clinical background to see if someone's in distress, and that so you learn where it's the right resource to point them towards. That's probably going to be sped up the rollout of that kind of information. But again, being sure that we are addressing that, because what we see that if students are not well and healthy, they're unable to perform academically. So that the part, and so I think our office in our state has definitely had a reckoning with that, is that especially exacerbated by the pandemic, that students were withdrawing or having difficulty at such clips, and they're overwhelming the counseling centers. I would love to tell you that we could all just have 100,000 counselors tomorrow. No, that is a pipeline issue that literally there's no way around that but time. So if your state only has, let's say, 100 social workers coming out, that's all you have. Like, there's no way to influence them, to create them overnight. So being intentional about what ways can we scale available resources to students, what ways can we make resources more available without burdening the staff on the campuses? Because speaking about the Great Resignation And so for us, some of our campuses, it takes 5 weeks to get an appointment at the counseling center. And so for us as that bridge, we're like, here, I know you're backed up in the counseling center, but be sure to filter them out into the community resources who have either short or no wait until they're able to get in to see you. And so being able to make sure that those partnerships are strong, because again, it does take everybody being targeted and intentional, because even though some of our places have the structural support, like Kevin mentioned, some of those structures are tired. And that is just the reality of where we are in higher ed.
I think the other piece of that, Allison, is that it's all interconnected. And so we can't say like, well, here's what we're doing about drinking and here's what we're doing about mental health, because these two things are interrelated, and our students are using alcohol to cope with their mental health. And like, it is just, and the bystander intervention is about whatever issue is the problem in front of you at that moment. And we don't need to we need to train them to intervene when somebody is struggling, no matter what they're struggling with, right? And so if we can understand that these issues are all interconnected and that they have a significant impact on students' ability to succeed academically, that we're talking about retention and graduation and keeping students around, not just alive, but enrolled in our schools, then we have to be able to address all of the issues that are impeding their academic success. So that's my soapbox issue on this one. But I would add that I think one of the things that we have done really well here is that we very intentionally scaled back the work that the coalition was doing when COVID began, because we knew that people couldn't add any more to their plate, right? So we said, what is absolutely essential for us to work on right now? But also, we intentionally look around at what is the passion and interest of the people who are maybe not being recognized. And I think we talk about with our students as well, right? I don't want your senior who's involved in everything to join this organization. I want your sophomore who's learning and building their skills. And it's the same with our staff. I don't need the director at every meeting. Who on your staff wants an opportunity to explore something new? We're throwing work at them because there's 5 vacancies. That person may not have some time to contribute, but do they want to? Is this a thing where they're going to feel valued, feel passionate about a topic, and maybe stay in their job longer because they found something new to do, instead of, well, you've been here 3 years, so move it along to the next job or the next institution. And so I think we can do a lot to retain our staff, to give our graduate students new opportunities by spreading the workload out and meeting people's interests. So I appreciated everything you had to say, Kevin, because I think it's exactly what we have to be able to do.
Amy, I totally agree. And so, because what happened when, so everybody at our office, I was like one of the odd units that was brought over from LSU and popped down at the Board of Regents. They all knew I did like alcohol and drug stuff, hazing stuff. She kind of like whatever, like behavioral kind of stuff they did. But when the news broke and the news was made national news, the student posted her suicide note on Instagram. And so that is how it went viral. I had 3 separate staff members who do not do this work at all said, I am passionate about mental health. However our agency responds to assist the campus, I want to be involved. 3 staff members who this is not their wheelhouse at all. Records, numbers, data, all that's their area, but they're passionate about mental health. And I will do this plug for NASPA. One of my favorite conferences is the NASPA Strategies Conference because I was wellbeing and health promotion leadership, sexual violence prevention and response, alcohol, other drug and violence prevention, and mental health. It is a 4-in-1 conference with 4 tracks because, as Amy mentioned, they're all interconnected. That there's no way to kind of tackle those issues without addressing all of them. And so if you have professional development dollars, that is one of the conferences I would highly recommend that people go to, because you get such a variety of interconnected things that all influence each other, that help us become better practitioners to do the work that we do.
The same is true for recovery. Folks who are interested in supporting recovery come out of the woodwork from all over the place. And they're a faculty member in the math department who's been in recovery for 12 years. And wants to be supportive, and there's somebody who's impacted in their family, and the recovery works the same way. When you can find those folks, your champions are all over the campus.
Thank you for your insights, which leads me to what I'm thinking is it's almost like, Kevin brings up this really important integral piece about structure, institutional structure. And I feel like we're kind of at this reckoning place where we have to recognize the information that Kevin is sharing and really take a deeper dive into that. But then we also have this immediate need for, student wellness and student mental health programs. And it's almost like, where do we focus? Can we focus on both of those at the same time? And if so, how? And I don't know, Kevin, if, if there's some resource or something that you could reference to help provide some data behind your information that you're providing around faculty burnout and how institutional structures impact that. It would just be really nice I'm a little bit of a data geek. I like to look at the data because then it helps me ask more questions, which could lead me then to solutions, at least, something. But I'm wondering, how do we take these two things that feel like they're almost butting heads right now? Like, we don't have enough faculty, and the faculty that we do have is they're running on empty. And then we have these student needs, these, mental health, high mental health needs, whether they're, having a mental breakdown or it's recovery or, they're using, whatever the case. So I'm just wondering, I guess, what's the answer?
Well, and I think one of the themes that has popped up a couple times, even as we've been chatting today, is that I think for too many people, we're placing the student experience and institutional working conditions into discrete categories, when the reality is that the two are very much connected. So you don't get positive student outcomes and student success, and students feel like they belong and are supported and graduate if there are not people that are working at those institutions who themselves are finding meaning in the work, feel like they have resources to complete that work, where demands are not excessive, where they feel adequately compensated and valued. And so the message that I've been trying to hammer home when I've been speaking with institutional leaders is basically exactly as my colleagues have mentioned. One route to have students stay and to graduate and to be successful is to invest more in your people and to really think critically about working conditions. And so part of the solution here is that institutions have to, for the first time in a long time, actually think about working conditions and working cultures. We have basically relied on there always being a crop of people that want to come work in higher education. And so we've got kind of an Amazon warehouse model where we just replenish. People come in, we burn them out, we replace them. And that doesn't work anymore. We know that we don't really have the competitive advantage that we once had when it comes to like working perks. So we used to say, yeah, we've got great benefits. Benefits aren't that great anymore. We used to be able to say, yeah, we've got professional autonomy and we've got flexibility. Guess what? The private sector is now running circles around us when it comes to providing flexibility to employers. And now on top of that, we are not keeping pace in terms of compensation for folks. And so we just can't sit back anymore and expect that we're going to be fielding deep pools of people that want to come work here. And so one of the keys to supporting students is supporting faculty and staff. You spoke a little bit to kind of the data piece connected to this. And there are a couple of things to keep in mind with this. One is that there are multiple different definitions at play and no consensus around how we ought to operationalize things like turnover. And so that makes it a little bit tricky. And so, we can't pull some data from like the Bureau of Labor Statistics, but that data, I think there's some questions around it. What I'm pushing is for institutions themselves to be collecting some of this data, because lo and behold, there are many, many institutions that are just not collecting data about the workplace experiences of the people that they're employing. And that kind of speaks to my first point around how this just has not been the priority that it needs to. My own system, the UNC system, has come out with some data around turnover, showing kind of a sharp increase in turnover starting around the summer of 2021 and continuing into where we're at now. It continues even into the present. And then there have been a number of different surveys from provosts and presidents indicating that faculty and staff well-being and retention are now kind of in the top 5 of issues at their institutions, which hadn't previously been the case when they had done surveys like that. And a couple of surveys from human resources and IT professionals indicating a kind of mind-boggling share of people that are looking for jobs right now that in the past were not. So some of that data for me, and just speaking, I'm in the higher ed world all the time. I'm speaking with my own students that work at institutions across my state. I hear from them directly, we've got vacancies. We are running searches where we've got 10 people who apply. I'm getting ads every single day from institutions where they are clearly trying much harder than they used to attract people. They've got flashy advertisements. They are trying to sell the fact that they're located on the beach. They are going to great lengths to try to get more people interested in these positions to apply. So all of those things for me add up to the fact that higher ed is not at all immune from this conversation around the big quit or the great resignation. And I do think that there is an opportunity in this moment right now where mental health and student success are huge, huge concerns, where we can bring in the piece around faculty and staff well-being, and that could help to meaningfully move the dial. I'm not saying that that's like the key to success here, but we've got to do a better job of paying attention to the people that we are asking to support students, because otherwise I think the rest of this kind of falls apart.
I definitely agree with what Kevin said. Like, I'm in several higher ed groups and the job postings are nonstop every day. And so one of the things that a few weeks ago, there was one of my colleagues tweeted something like, what is something like you're worried about in higher ed over the next few years? My number one concern is that in 10 years or less, we will have an even greater resignation. And the reason why I say that is because of public service loan forgiveness and temporary public service loan forgiveness. People are getting loans forgiven quickly. And I know tons of people say, once my loans are forgiven, I am out of higher ed. I am out of higher ed, because most of them work at public institutions. And so they're getting credit and they're like, there's like the burnout, the pay, the turnover, the other duties as assigned that are increasing, not keeping up with the rate of pay as private sector. So there are a lot of them are leaving out, going into places like ed tech, where let's say they're doing prevention work through ed tech instead of at a campus where they're being overworked and not paid. And so definitely we have to invest in the people that we're asking to make sure that our students are well on campus.
The other thing I'll mention very quickly is another drum that I frequently beat is, as organizations that are ostensibly predicated on human development, we have extremely poor systems for professional development in place for the vast majority of people employed in higher education. So, don't get me wrong, there are opportunities, there are systems, there are institutions that do this well, but speaking broadly, you can have folks working at a role in higher education for 10 and 12 years that receive very little training from their own institutions. Everything gets farmed out to some sort of outside organization, and you just hope that they're putting on some sort of event or program or conference that speaks to your own professional development needs. And so that I don't think that's going to work moving forward. We're going to need more robust internal systems of professional development, one, to help people grow in their jobs and to keep them, but two, because our students are changing, their needs are changing. The big question for me is, let's say we've got faculty that are on the front lines with that are helping students with mental health needs. Maybe we don't want that to be the case, but that is happening. It is the case. What are we doing to support and train faculty in those roles? And like I said, if my institution is at all reflective of a trend or what we expect to be the case across higher ed, it's almost nothing. And so that, I think, is kind of a red flag. And one way that we help with that is to build better professional development systems.
I know we only have a few minutes left, and I could talk to you guys all day about this topic. And I know I'm getting something out of this, and I hope that, that our participants are too. Kevin, my question to you is, when you talk about professional development for higher ed, what does that look like now? I don't know what it once looked like, but I imagine that it's probably different than what it could look like now.
Yeah, obviously it varies from institution to institution. But as I said, the model has typically been for example, for student affairs professionals and for faculty. For faculty, you get trained in your doctorate and then you get put in a job and you do that job pretty much forever. If you do professional development, it has to be either motivated by the person itself or through like a Center for Teaching Excellence. And similarly, on the staff side, you may get it through a supervisor. There may be some professional development offered internally, but it's usually farmed out to a professional association where you would attend, again, events or trainings, etc. So compared to, for example, a private sector organization, we just do not have professional development systems. We have HR offices that are primarily focused on compliance and onboarding. And that's not the same as saying, we've hired you because we believe in your talent. We want to see you grow over the course of 15 years into different skill sets, different interests, and even different positions within our organization. We are, I think, far too content in higher ed with placing people in a job, and they either stay, or if they want to grow, they go somewhere else. And I think that, you know, the way that we've approached professional development has meant that we've lost a lot of talent. And it also means that we're not as prepared as we could be for when these issues that are in the future come to meet us in the present.
Thank you. So I'm going to turn it over to Ashley to wrap us up in these last, or I'm sorry, this last 1 minute. Please, please, please complete the evaluation. And thank you so much, Kevin, Amy, and Allison, for such a robust conversation around 3 different topics that actually quite intersect with each other. And I look forward to having more conversation around this topic. So thank you very much for taking the time to come and present to our audience.